Ladies and gentlemen, please welcome GPhA President and Chief Executive Officer, Chip Davis.
Good afternoon, everyone. Oh, come on. Good afternoon, everyone. Yeah. It's that post-lunch nap thing I'm trying to avoid here. Welcome to the 2016 GPhA annual meeting. Now, depending on whether or not you were attending the luncheon a short time ago, this is either the first or the second time I have now welcomed you to the 2016 GPhA annual meeting. If it is the second time, my apologies for being redundant. Let's just say you can blame it on me being the new guy. Not certain how long all of you in this room will let me get away with that moniker, i.e. the new guy, but for reference, I can tell you it lasted exactly 6 hours on my first day at GPhA when it came to working with my colleagues. One thing I can say with absolute certainty and without reservation is how excited I am to be here with all of you at this beautiful event in Orlando and at this most important meeting for our entire industry. In addition to having the opportunity to either connect or reconnect with industry colleagues, business partners, vendors, and others who play such an important role in delivering high-quality, highly effective, and safe and affordable generic medicines, this meeting allows us to assess really where GPhA and the industry have been of late, where we are now, and most importantly, where we are going against the backdrop of so many issues that have the ability to significantly impact our companies and the patients that you all serve. Before going there, however, there are some thank yous that are more than in order. First, on behalf of GPhA, let me thank the 2015 and 2016 Board of Directors, the latter of whom just assumed their roles yesterday. Their leadership and direction that they provide us on a regular basis is indispensable to the success of our association. I also want to thank and recognize our officers, both outgoing and incoming. To Craig Wheeler, who has served as chair for the last 2 years as an officer for 6, and to Doug Booth, who has served as Secretary-Treasurer for the last several years. GPhA and our member companies are indebted to both of you for your leadership and your support of the association. And speaking personally, both of you have helped me immeasurably as I tried to onboard and assimilate as quickly as I possibly could. Let me also warmly congratulate and acknowledge and welcome our new board chair, Heather Bresch. We will hear from Heather momentarily, but let me just say how fortunate we all are here today to have Heather leading the board and our industry advocacy efforts at such a critically important time for this industry. When it comes to CEO engagement with policymakers, Heather indeed sets a very high standard for this industry or for any other for that matter. And I can say that knowing firsthand, given some things I've done in my prior life. Certainly something that we will be looking to leverage in furtherance of our priorities as we move forward. So we look forward to hearing from Heather shortly. I want to extend thanks and appreciation as well to our new Vice Chair, Jeff Watson, and to our Secretary-Treasurer, Tony Pera, both of whom assumed their roles yesterday. We are incredibly fortunate and grateful and thankful to them, who are now serving as officers of the association. By now, I guess if this was the Academy Awards, they'd start playing the music because I'm going on with the thanks. But again, you can sort of blame me. This is my first time here. So I do want to thank all of the speakers that you will hear from for the next 2 days. I want to thank all of you in this room for being here, because by taking time out of your schedules, you are showing how much you care for this industry and the role that it plays in providing patients with access to high-quality, affordable medicine. And last, and frankly, most important to me, I want to thank the team at GPhA. You know, from the moment that I arrived, it was clear to me that I was going to have the opportunity to work with some incredibly talented people, some incredibly dedicated people. And as the new CEO, I am very, very fortunate in that regard. To be completely candid, the team at GPhA has an immense workload. In terms of headcount, we are not all that big, so we need to be maximizing every minute of every day on behalf of all of our members. And in particular, to our meetings department, the little team that could, if you will, Jennifer and Akira, I'm very pleased to be able to tell all of you that once again, GPhA has set new record levels in terms of both attendance and sponsorships for this year's meeting. So please join me in congratulating them for a job well done. I actually had to promise both of them a ride in that NASCAR vehicle outside when this is over. So As I said, this is my first GPhA annual meeting, and prior to joining GPhA just about 6 months ago, I had spent the better part of the last 20 years working on the branded side of the drug industry, which may be why a lot of you, ever since my appointment was announced last year, understandably asked yourself the following question, which is, how did this poor guy get stuck with a name like Chester? Well, I can tell you, that's what happens when you are the sixth child born into an Irish Catholic family and you're the first boy. When your parents go 5 for 5 with girls, I can assure you that by the second trimester, the name picked out for me was Anne Marie and the nursery was Pink. And that's a true story. My parents literally did not have a boy's name picked out, so after a couple of days, they ended up naming me after my father, which, all kidding aside, has been and continues to be the greatest honor of my entire life. But to the more serious question, given your background, why you? Why did the board hire you, a brand guy, to lead GPhA? It is certainly a fair question. Well, I won't answer for the board because that's within their purview, but what I will tell you is why I wanted this job. Like many of you, I suspect, I have been and I continue to be a big fan of innovation. Many advances in innovative medicine, and particularly of late, have been nothing short of amazing. In fact, I don't have to look outside my own home any day to realize the benefits of innovative medicine. My wife and I have 3 children, a boy and 2 girls. 2 of them have special health needs. My son has Crohn's disease, and my oldest daughter is on the autism spectrum. And both of their lives, and by extension our life as a family, have been immeasurably and positively impacted by the development of innovative medicine. But over the years, formed both by professional and personal experience, and particularly with the introduction of specialty medicines, more than ever, I have come to the conclusion that in and of itself, innovation isn't sufficient to do the job. For the end game to truly work, for the patient, the provider, the payer, the system, the government, for everyone to get the outcomes that they need, innovation has to be coupled with affordability. And from my perspective, the generic and biosimilar sectors are where innovation and affordability intersect. And that, in a nutshell, is why I wanted to be here. And I am deeply grateful to the GPhA board and the search committee for affording me this wonderful opportunity. So what I want to do for the next few minutes is to share with you some thoughts on sort of where we have been, what we anticipate the road ahead looking like, and in our view, what it's going to take to make sure that the generic and biosimilar industries are positioned for success within the political and within the policy environments that we anticipate having to deal with and react to. So how do we do that? Well, first we'll do a quick rewind on 2015, where we have been. Last year, GPhA and its members had a significant number of demonstrable successes during what could only be characterized as a significant year of transition for the industry and obviously for the association. But there were some significant challenges along the way. Second, the road ahead. As we enter 2016, which we all know by now is a critical election year, it is very fair to say that the road ahead will be very different than the road just traveled. And so we will have to ask ourselves if it will be sufficient from an overall advocacy perspective to bring the same historical approaches to the way that we have engaged in Washington and in the States. My view, for one, based on what I have seen in my relatively brief tenure so far, combined with my previous work experience, I would emphatically say that the answer to that question is no. I believe it would be the equivalent of deploying a dial-up modem strategy in what is now a Wi-Fi world. Third, what's our plan? What is the prescription for success? The good news is this industry has such an incredible value proposition, and no one has the ability to control our fate more than we do. So we'll spend some time at the end talking about our prescription for success. So when the election year rhetoric dies down and real health policy making begins anew, we are seen, most importantly, on the right side of the ledger as a significant part of the solution to rising healthcare costs, not part of the problem. So let's get going. In 2015, as I said, it was a challenging external landscape, but there was significant progress on a number of fronts that warrant reference. First, enhanced engagement with the FDA. Yes, it is an ongoing issue, and a constructive dialogue is vitally important, whether it's around things like GDUFA 1 implementation, preparing for GDUFA 2, starting GDUFA 2, BSUFA, quality initiatives, and the like. We have a long road ahead of us, but working constructively with the FDA starts with having open, important, constructive dialogue with them throughout the course of the year. Second, everybody here understands how big a priority the labeling rule is. It is a major issue and concern for all of our members. It was delayed twice throughout the course of 2015. That's the good news. The reality is, though, we are going to have to and will continue to express our concerns related to the prospects of an unnecessary level of patient and provider confusion if the current rule is implemented as drafted. And we will carry this message and continue to carry this message to the FDA, to the Hill, and to the media. Third, the patent bill was extended. This was a bill that many of you may know was originally designed to curb certain practices of patent trolls, but then was looked upon as an opportunity by some in the biotech and branded pharma sectors to try and carve out Hatch-Waxman cases from the IPR process, which is a vitally important process that we maintain and secure to challenge questionable patents. This ultimately was stalled shortly before it went to the full House floor for a vote, and it had significant momentum, so there was a lot of great work that was put in to make that happen. There were several exclusivity extensions in the House 21st Century Cures bill that were significantly curbed from first draft to final passage. The Trans-Pacific Partnership Free Trade Agreement, there was a lot of work done there. Between the beginning of the year and the end of the year, this was a 6-year journey, and the reality is it is a far from perfect trade agreement. But where it ended up saw improvement over where things started the year on. In addition, we added 10 new member companies if we look internally as an association. Critically important to us to continue to add and recruit new members. To be candid, it helped offset the loss of a couple of significantly high members in top tiers of our association. We didn't lose anyone because they were dissatisfied with the association. The reality was, through ongoing market consolidation, it can provide a degree of revenue risk that we're looking at currently. Present company excluded, we brought some new talent onto the GPhA team, and we will continue to do that and assess to make sure that we have all the right people in all the right places with all the right accountabilities. And we launched the Biosimilars Council, the first of its kind resource which works to ensure a positive regulatory, reimbursement, political, and policy environment for biosimilars products. And will also educate the public and patients about the safety and effectiveness of biosimilars. Our continued thanks to Chairman of the Council, Bert Liang, to Bruce Leitcher, who's now the Vice Chair, and to Bruce Lott as Secretary Treasurer, and the Council met this morning while here. So thanks to all of you for your continued leadership as the Council continues to ramp up their efforts. We also released the annual savings report that many of you are familiar with, some of which you just saw on the screen behind you. This was the 7th annual release. It said that in 2014, because it's on a 1-year lag, the generic industry saved the U.S. healthcare system $254 billion in that calendar year, and now has a rolling 10-year average of almost $1.7 trillion, which, by the way, is even big money in Washington. How do you actually put context around that, though? I had some people say, you know, the problem is that we put that out year after year, and we don't have the right context. Some folks are just accepting it as fact now or take it as a given. Well, what does $254 billion get you? Well, if you're the federal government, for $254 billion, you can pay for the entire Medicare Part D program, the entire Medicare Part B program, the VA, the TRICARE, and the entire CHIP program, no relation, drug and non-drug, for 2 years. And you would still have $50 billion left over to invest in other areas, whether it was things like NIH research, or perhaps the recent initiative announced by the Vice President and the President to take the moonshot effort at curing cancer. What else did it show? Well, we actually this time took a little bit of a different approach with the data. We cut it down state by state, so it's not just relevant to federal policymakers, it's relevant to state policymakers. We cut it by therapeutic area. So now we have opportunities for engagement in the patient advocacy community to remind patient advocates how important generics are to making sure that the patients that they represent have access, right? We did it by government program, and we did it by demographics. So if you have not had an opportunity to fully read this report, I cannot encourage you enough for reasons that we'll get to in a minute. But again, as you can see, there were truly some significant achievements in 2015. But it was a year of also significant challenges. The labeling rule was delayed. It has not been retracted, it has not been repealed. So there's more engagement on that front that is needed. There is still the issue of the backlog that we have to continue to work our way through. There is uncertainty around biosimilars, naming interchangeability, to name just two. And in the wake of some high-profile media coverage of older off-patented branded medicines, we found that there was significant conflation and confusion over what is in fact a generic medicine versus what is in fact an older off-patented brand. In fact, if I was to tell you the thing that surprised me the most in my first 90 days, it was how many times to the media or policymakers I had to tell people, to be completely blunt, that Daraprim was not a generic drug. The sensitivity to generic drug pricing from policymakers and lawmakers in Washington and at the state level, as many of you know, is now at an all-time high. Our message of affordability and savings got distorted to some, even some that had historically been champions for this industry. As part of the budget agreement last fall, as many of you know, Congress passed and the President signed an increase in the Medicaid rebate for generic drugs, applying the inflation rate rebate penalty that historically had only applied to branded drugs, and that will start this year. Think about that for 1 second. This industry, the people in this room who deliver almost 90% of the entire prescription marketplace in the US for slightly more than only 1/4 of the total cost. Name another industry that can do that. And the reward for that was that Congress decided to use the generic industry as a pay-for in the budget agreement. Many of you have asked, and all of you have a right to ask, why did that happen? Well, contrary to a long-standing criticism of some lawmakers, meaning that all they do is talk, I can assure you the reality is that they also listen. And their constituents and voters back home have been telling them this, that prescription drug costs are the #1 healthcare issue in this year's election cycle. Take a look at the polling on the screen behind me. It's done by the Kaiser Family Foundation. As we all know, healthcare has been and continues to be a politically polarizing issue here in the United States between the right and the left. If you have any doubt about that, look at the fact that we're still talking about whether or not to repeal Obamacare 7 years after it was originally proposed. However, when it comes to drug costs, these numbers, and there are many other polls showing similar results, do not show much in the way of polarization. There is high concern among Democrats, Republicans, and independents. And when Congress sees numbers like this, as an initial takeaway, and to be blunt, there's not much in the way of political downside by them taking action in this space, which is exactly what they did in implementing the CPI penalty provision last fall. And as unfortunate as this provision is, and the harsh reality is that this was Congress sending us a message that we need to pay careful attention to. Despite the level of savings this industry provides to the entire healthcare system annually, when they need to find funding, whether it's to finance a budget agreement, which was the case in the fall, or whether it's to pay for increasing resources in some other area, they have now squarely put us on the radar. What do I mean by that? Well, for starters, it means that even though this industry continues to year after year drive greater level of savings to the entire US healthcare system, there are some policymakers that either don't recognize that, don't care, or even worse, perhaps have begun to take it for granted. And historically speaking, some of this industry's biggest congressional supporters, folks like Senator Tom Harkin and certainly Congressman Henry Waxman, now all have one thing in common. They're retired. This is what I mean when I say that the ground has shifted under our feet, and it is absolutely vital. It is not good to do, it is a must do, that we have to build a new legion of champions and supporters for this industry to get buy-in and understand and appreciate the value proposition associated with it. Some of you might be saying at this point, well, wait a minute, it can't be all that bad, right? At the end of the day, we're still the greatest value in the healthcare system, right? They have to know that. That is true, but it isn't enough to say that amongst ourselves. There is a gap in understanding among some policymakers, not all, but some, enough, that we need to collectively close. Again, I go back to the polling showing this is the #1 healthcare issue in the election year, even higher than the debate around Obamacare. And if you don't want to take my word for it, let's take a quick look at the following video.
We've all seen the headlines on soaring generic drug prices. But the facts show that generic drugs drive savings, not costs. For more than 30 years, consumers have relied on safe and effective generic drugs to provide the treatments they need at a price they can afford. But today, the industry's core message of savings, access, and affordability is drowned out by news of isolated price increases on a small handful of outlier drugs. And the most notorious increases are not even generic, but older, off-patent brand drugs. In 2015, the ground shifted.
To take on not just Wall Street, but the pharmaceutical industry.
It's predatory pricing. We need to use every tool at our legal disposal to shut this down.
Drugs with Medicare, they don't bid them out. They say like 300 billion could be saved if we bid them out. We don't do it. Why? Because of the drug companies, folks.
The industry that provides nearly 90% of the nation's prescription medicine for less than a third of the total drug cost, delivering $5 billion in savings every week, is seen by many as part of the problem rather than the solution.
The landscape has already changed. We've seen some policies pass pertaining to biosimilars and generic price hikes that never would have passed the laugh test before. And in last year, 2015, those were able to pass. And so I would argue that things have already shifted.
As critics get louder and misinformation spreads, the generic drug industry faces new and unprecedented risk. The real question for all of us is, what are we going to do about it?
So indeed, that is really the question before us. What are we going to do about it? The reality is that the Medicaid CPI penalty is just one example of what has been, over the last several years, a long list, something that we refer to internally as a parade of policy foibles, if you will, that have the potential to negatively impact our ability to continue to provide the level of success in the marketplace and the access to patients and the affordability to patients moving forward. Behind me on the screen are a number of these issues scrolling that are on that list. The reality is we don't have the time today to go through all of them, but let me just say this. The policies on this screen, if implemented, would expose our companies and the generic and biosimilar industries to billions of dollars in either increased costs and or lost revenue over the next decade, which would then subsequently have stifling effects on all of this industry's ability to continue to provide the same level of affordable, high-quality medicine in the U.S. and abroad. And by the way, if it is up here, it made it not because of things that we were sitting around for contingency planning purposes and thinking about. It made it up here because one or more factions in Washington, whether it's the administration, whether it's Congress, whether it's other healthcare stakeholders, are actively involved in the ongoing debate, are currently advocating for one or more of these issues. So I shared earlier that the road ahead will be different than the one behind us. What did I mean by that? Well, as whether we realize it or not, a year from right now, when we reconvene, we will be operating in the first few weeks of a new administration and a new Congress. It is incumbent upon us at GPhA, working with our members, to make sure that the new Congress and the new White House recognize us for what we are, which is a solution to increasing healthcare costs, not the cause. So how will we go about doing it? Well, fortunately, here's the good news. Because of our board and our team at GPhA, we have a strategy. Last fall, the team developed and the board endorsed a strategic action plan for 2016. The plan is based on three foundational pillars that are on the screen behind you. The first is to win and deliver on priority issues. The second, to enhance the generic industry's share of voice. Third, to build an effective, efficient, best-in-class trade association. Everything we now do at GPhA is intended to be aligned around one or more of these three pillars. So let me take a minute to summarize each one of them for you. The first, win on the issues. No surprise. This is the first among equals. Within this area, we have broken down the major legislative, regulatory, and policy issues into three main buckets. Those issues where it is incumbent upon GPhA to take the lead, for instance, things dealing with like labeling and cost market access issues, GDUFA 1, GDUFA 2. Those where we engage with like-minded stakeholders, creating sort of a coalition of the willing, if you will. Things like patent reform, pharmaceutical take-back issues at the state level apply here. And those issues where we monitor. We have no shortage of priority issues across all three of these areas, which means we need to remain flexible to adjust our level of focus, concentration, and deployment of resources depending upon what issues are most pressing at any particular moment. Second, increase the industry's share of voice. You know, there's a saying in Washington and many state capitals that if you are not at the table, then you are likely on the menu. In other words, if you are not part of the policy conversation, you might one day wake up and find yourself the subject of it. Two things are worth noting here on this pillar. First, it deliberately says the industry's share of voice, not GPHA's. Where we can and where we should. As an association, we should be leading the charge and will lead the charge. But if the entire industry is not both advancing and defending our interests, we run the risk of being drowned out by others in the healthcare space who are dedicating exponentially more time and resources to the debate than some would argue we have in the past. Candidly, we have work to do in this area. As noted, we will have a new administration, and they need to make sure they understand our value offering. In Congress, we need to build and strengthen relationships with new members on both sides of the aisle to cultivate new legislative champions for the industry. And we need to work with congressional delegations across the country, House and Senate members, in key states where this industry has a significant economic footprint, to let them know that in addition to the level of savings of millions of dollars that this industry is providing to the congressional delegation, to governors, to state health secretaries and the like, that this industry is also helping to drive the state's economy with good, high-paying jobs. The good news is there's a template, or a roadmap, if you will, in place to guide us as we move forward here. Since I joined GPHA last fall, I have to tell you, I have tried, and I've been trying to be in full immersion mode, as you might expect. I've had the opportunity to visit with a number of our member companies. Time and time again, it has been so incredibly impressive to see the level of focus, effort, concentration that company leaders pay to their various customer segments, the suppliers, the distributors, the GPOs, the PBMs, insurance, the list goes on and on. I would submit to you all that engagement in Washington, while it's with a different constituency, or at the state level, is really not all that different. Ensuring this industry's success in the societal marketplace, if you will, which I like to think about in terms of the political and policy environment that often sets the rules of engagement for the commercial marketplace, is every bit as important as our activity and our engagement in the commercial marketplace to ensure company success and industry sustainability. The good news is, moving forward, the key will be to maintain that level of focus and success in the commercial marketplace while we collectively elevate our presence on issues that fall primarily within the jurisdiction of the Congress and the new administration. We also have the opportunity to work more collaboratively within the patient advocacy community. We are almost 9 out of every 10 prescriptions in the United States, and the nature of our working relationship with the patient advocacy community is not as strong as some might think. Now, yes, many in that community have long been on public record talking about the importance of innovation, and by extension, on certain issues, they are inclined to support things like stronger IP, as an example. But you know what else the patient advocates seek? They want to make sure that the patients that they represent can afford their treatments. And a strengthened engagement on that front can seek to achieve more of a balance between innovation and affordability when they are debating their own position on various legislative issues. That work has already started. At the end of last year, GPHA joined the National Health Council, which is a patient-centric organization, essentially a trade association of patient advocacy organizations, which brings together all segments of the healthcare community to work on issues impacting the more than 130 million Americans who are suffering with some form of chronic disease. And we were immediately asked upon joining to join the Council's Health Policy Committee, which we have committed to doing. We also need to elevate our voice within the larger business community, so that as they continue to try and address challenges associated with increasing healthcare costs as employers, they, like the government, are reminded which side of the ledger this industry belongs on, which is why, after a long absence, GPHA has rejoined the U.S. Chamber of Commerce, and as a result has been asked to participate in the Association of 100 moving forward. Lastly, when needed, we can turn our employee base into ambassadors. You know, it is not every day, nor is it every industry, that you can go to work and pursue your company's business objectives that are, in essence, completely aligned with the interests of patients, providers, the healthcare system, the government, and the overall U.S. economy. And when from time to time there are various legislative or regulatory proposals that come along to threaten that alignment, we should not hesitate to weigh in across the entire industry by making outreach to our local policymakers to ensure that our voice is collectively heard. Last and certainly not least, we need to continue our growth and development towards becoming the most effective, efficient, best-in-class trade association that we can be. Our members deserve nothing less. Well, what do I mean by that? Well, for starters, it means that we have to have all the right people in all the right positions, as I said earlier. But it goes well beyond that, too. It is about providing excellent member-focused services and increasing our communications across the entire membership. We need to recruit new members, as I said previously, and we need to make sure that we are operating in a way that assures all companies, the large companies, the small companies, and those somewhere in between, always have the opportunity to share their views and help shape GPHA's policy positions. And we need to make sure that when GPHA and the Biosimilars Council speak, it is clear that we are speaking on behalf of the industries that we represent. That is not to say on any given issue that an individual company, one or more, may not have their own position. In fact, that happens all the time within trade associations. But how that is handled, how that is communicated externally to outside forces is critical. Because if we don't get that right, it can have a negative and at times even debilitating effect on a trade association and its future ability to advocate on behalf of an entire sector. At GPHA, we will always work very hard to drive consensus, mindful of what Ben Franklin once said many years ago, which is we must indeed all hang together, or most assuredly we will hang separately. Over the long haul, as an association, on behalf of any industry, it is being seen as having a fractured membership will not have a strong share of voice in the relevant debates. So we have to not only get to the right endpoint, we have to have the right process to assure that we get there and make sure that everybody is heard along the way. And last and not least, as we go about implementing this strategy, we need to seek to capitalize on all of you. We need to leverage your knowledge, we need to leverage your experience, your expertise, and your company resources when and where appropriate. When it comes to some of our priority issues, we are setting up against some other industries that at times can deploy far greater resources. Leveraging the resources of our companies, therefore, those that have Washington offices or have people deployed in the States or consultants in either place, can help reduce the gaps that we sometimes are confronted with. The last point is critical because, as all of you know from a business perspective, a good strategic plan, poorly implemented, is not a good strategy. So while we have together accomplished a lot over the past 12 months, it is clear that we have some significant hurdles ahead that also need to be addressed. In closing, I have a request for everyone in this room from the industry to take back home with them. Consider it, if you will, a small homework assignment from Orlando. First, if you are a company that is actively engaged on its own behalf and in working and driving our efforts at GPHA at the federal and state level on major policy issues, first, thank you for that, and second, please keep it coming. If you are a GPHA member and you are looking for ways to get more actively involved, please commit to doing so, and together we can work collaboratively together to make that happen over the coming weeks. And last, if you are not a member of GPHA or as a company directly engaged on proprietary issues impacting your business performance, whether it's in Washington and or in the States, my ask is that when you return from this meeting, you assess whether or not you, given the environment that we have just seen in some of the examples on the slides in the video, if you think that's the right approach moving forward. And if you don't, or even if you have a question about it, please give us a call and give us the opportunity to talk about it over lunch or coffee at some point, and we'll come to you to do that. The reality is, as an industry, if we don't stand together and tell our story, we will leave a space that others will gladly step into to try and define it for us. We can and we should be the authors of our own narrative. Let me bring this to a close by finishing where I started, which is by thanking all of you for being here, for your commitment and your support of GPHA and this entire industry, and for the opportunity to join your ranks to work together for what is in the best interests of our members, both generic and biosimilars, on behalf of the patients, providers, and other healthcare stakeholders who rely so much and benefit so much from the work that all of you do. It is indeed a real privilege to be with all of you here today and moving forward, and thank you for your time. I appreciate it. Thanks very much.